That pill you take every morning, the one your doctor prescribed years ago, the one you've never questioned, may be the single most significant reason your memory is not what it was. Not age, not stress, not genetics, the medication sitting in your cabinet right now. And the most dangerous part? The effect is so gradual, so quiet, that most people over 60 mistake it for something they cannot stop, something they have no control over. You do. I'm Dr. Elena Marsh. I've been practicing internal medicine for over 2 decades, and I have sat across from hundreds of patients, sharp, capable, independent adults, who came to me frightened that they were developing dementia. In many of those cases, the culprit wasn't a disease, it was a prescription. A 2023 review published in JAMA Internal Medicine identified a specific class of medications taken daily by tens of millions of Americans over 60, that significantly impair memory, processing speed, and cognitive function. Not as a rare side effect, as a documented, measurable, consistent pattern. Your doctor may have mentioned this. Most don't have time to. Quick question before we go further. How many prescription medications are you currently taking? 1, 2, 3 or more? Type your number in the comments right now. I read every single one. Here's what's happening inside your brain, and why this is more urgent than most people realize. Your brain is not a static organ. After 60, it becomes what researchers call increasingly vulnerable to pharmacological cognitive burden, a term that simply means the cumulative weight of what you are asking your brain's chemistry to process, day after day, year after year. Every medication you take interacts with your brain, even medications that have nothing to do with your mind. Blood pressure drugs, antihistamines, sleep aids, bladder medications, antidepressants, acid reflux pills, muscle relaxants, certain antibiotics. Each one crosses what is called the blood-brain barrier, the protective filter between your bloodstream and your brain tissue, in ways that accumulate over time. This is not a theoretical risk. A landmark study published in JAMA Internal Medicine followed more than 3,000 adults over the age of 65 for 10 years. What they found should be on the label of every pill bottle in your cabinet. People who were taking one or more drugs from a specific anticholinergic class had a 54% higher risk of developing dementia compared to those who weren't. Not 10%, not 20%, 54%. And here is the part that changes everything for you specifically. Anticholinergic drugs are not a specialty category. They are ordinary medications, the kind you pick up at your local pharmacy, the kind prescribed for the most common conditions adults over 60 deal with every day. Overactive bladder, allergies, insomnia, anxiety, depression, heartburn. Let me explain the mechanism. Because once you understand what these drugs are doing inside your brain, the list I'm about to give you will never leave you. Your brain communicates through chemical messengers called neurotransmitters. One of the most critical, especially for memory, learning, and attention, is acetylcholine. Think of acetylcholine as the signal that tells your brain, remember this, store this, retrieve this when you need it. Anticholinergic drugs work by blocking acetylcholine receptors. That is literally how they achieve their effect in the body. Whether they're calming an overactive bladder, drying up allergy symptoms, or helping you sleep, they interfere with acetylcholine. And when they do that in the body, they do it in the brain too. In a younger brain, this interference is temporary and largely recoverable. But in a brain over 60, a brain that is already producing less acetylcholine than it did at 40, blocking what remains is not a minor inconvenience. It is the neurological equivalent of dimming the lights in a room that was already getting dark. And for many people watching this right now, those lights have been dimming for years. Now, I want to give you the 9 medications specifically. Not categories, not vague warnings, the actual drugs, the names you will recognize, the names that may be in your cabinet right now. The first is diphenhydramine. You know it as Benadryl. You may also know it as the active ingredient in Zizquil, Unisum, and most over-the-counter sleep aids marketed specifically to adults over 60. Diphenhydramine is one of the most potent anticholinergic compounds available without a prescription, and it is taken nightly by millions of Americans who believe they are simply helping themselves sleep. What it is also doing, every single night, is blocking acetylcholine in the brain. A study published in JAMA Internal Medicine found that people who used diphenhydramine regularly for 3 or more years had a significantly elevated risk of dementia. The sleep it provides is real. The cost it extracts is also real. The second is oxybutynin. Prescribed for overactive bladder under brand names like Ditropan, this medication is handed to adults over 60 with very little conversation about what it does beyond the bladder. What it does beyond the bladder is cross the blood-brain barrier at a high rate and suppress acetylcholine activity with particular aggression. Researchers at the University of California, San Diego found measurable reductions in memory and cognitive processing speed in patients taking oxybutynin, reductions that appeared within weeks of starting the medication. The third is amitriptyline. An older antidepressant still frequently prescribed for depression, nerve pain, and insomnia, amitriptyline carries one of the highest anticholinergic burdens of any medication in common use. Many patients taking it have never been told this. They have been told it helps with pain. It does. They have not been told what it may be doing to their ability to remember the name of someone they have known for 30 years. The fourth is paroxetine, sold as Paxil. Among the antidepressants, paroxetine stands apart because of its unusually high anticholinergic activity compared to other drugs in the same class. Patients who could be on a different antidepressant with a much lower cognitive burden are sometimes kept on paroxetine for years simply because it was what was prescribed first and no one revisited the decision. The fifth is promethazine, a prescription antihistamine and anti-nausea medication that crosses the blood-brain barrier rapidly and carries significant anticholinergic load. Often prescribed for motion sickness or nausea in older adults, its cognitive effects are rarely part of the conversation. The sixth is tolterodine, another bladder medication, sold as Detrol, that functions similarly to oxybutynin. The anticholinergic burden is slightly lower, but still clinically significant, particularly when taken alongside other medications on this list, and that combination is more common than most people realize. The seventh is cyclobenzaprine, a muscle relaxant prescribed for back pain and muscle spasms, one of the most common complaints among adults over 60. Cyclobenzaprine carries a high anticholinergic load that is almost never discussed during the prescription conversation. Patients are told it will help with the pain. They are not told it may be quietly impairing the brain they depend on for everything else. The eighth is hydroxyzine. Prescribed for anxiety and as a sleep aid, hydroxyzine is sometimes presented as a safer alternative to benzodiazepines. In terms of addiction risk, that may be true. In terms of anticholinergic burden on the brain after 60, it is not a safe alternative at all. It is a significant one. The ninth is ranitidine, and its modern replacement, famotidine, sold as Pepcid. Acid reflux medications in the H2 blocker class carry anticholinergic properties that most gastroenterologists do not lead with when writing the prescription. Taken daily for years, which is how most people over 60 take them, they contribute to what researchers now call cumulative anticholinergic burden, the total load your brain is carrying across every medication you take simultaneously. That cumulative burden is the real danger. It is not one pill. It is 3 pills, taken together every day for 5 years in a brain that was already running low on acetylcholine before the first dose. Has your doctor ever explained this to you? Write never or yes in the comments right now. Your answer matters more than you think. You didn't know. Now you do. That changes everything. The question is no longer whether this is happening. The research has answered that. The question now is what you do about it, starting today. And that is exactly what comes next. Stay with me, because the protocol I'm about to give you addresses all of this directly. It is free, it requires no new prescriptions, and it starts today. Here is exactly what I want you to do. Starting today. I call this the Cognitive Protection Protocol. 5 steps. No prescriptions, no supplements to buy, no equipment. What this protocol does is work with your brain's existing chemistry to protect and support acetylcholine function, while you have the conversation with your doctor that this video is going to help you prepare for. These steps do not replace that conversation. They begin the protection while you wait for it. Step 1. Calculate your anticholinergic burden before your next appointment. There is a validated clinical tool called the Anticholinergic Cognitive Burden Scale, the ACB scale, developed by researchers at Indiana University and now used by geriatricians worldwide. Every medication on the list I just gave you has been scored on this scale from 1 to 3, based on how aggressively it blocks acetylcholine in the brain. A score of 1 means mild burden. A score of 3 means severe. And the research is unambiguous. A combined daily ACB score of 3 or higher is associated with significantly accelerated cognitive decline in adults over 65. What I want you to do is write down every medication you take, prescription and over-the-counter, and bring that list to your next appointment. You can find the ACB scale online at no cost. Look up each medication, add the scores, show your doctor the total. That number will begin a conversation that your 10-minute appointment never made room for. You are not questioning your doctor's competence. You are giving them information they need and rarely have time to gather themselves. That is what an informed patient does. That is what this video is making you. Do this before your next appointment, not after. Before. Step 2. Eliminate the over-the-counter anticholinergics first. Of the 9 medications I named, several require a prescription to change. But diphenhydramine, Benadryl, Zizquil, the nighttime sleep aids shout does not. You can stop taking it today. And I want you to understand why that matters beyond the obvious. When you remove the highest burden over-the-counter anticholinergic from your daily routine, you are not just reducing one drug's impact. You are lowering the total cumulative load on your brain's acetylcholine system, which means every other medication you are taking has less competition for the receptors that remain. The brain does not experience your medications one at a time. It experiences all of them simultaneously. Removing one changes the entire equation. For sleep, the research supports 2 alternatives with 0 anticholinergic burden. Low-dose melatonin, 0.5 to 1 milligram, not the 10 milligram doses most Americans take, which is far above what the brain needs, and what sleep researchers call stimulus control therapy, a behavioral approach that is more effective than any sleep medication for chronic insomnia and carries no cognitive cost whatsoever. Talk to your doctor about both. Step 3. Protect your acetylcholine production through targeted nutrition. Your brain manufactures acetylcholine from a nutrient called choline, and the research on choline intake in adults over 60 is consistent and underreported. The majority of Americans in this age group are not getting enough. A study published in the American Journal of Clinical Nutrition found that higher dietary choline intake was directly associated with better cognitive performance and reduced markers of brain aging in older adults. The foods with the highest choline content are eggs, specifically the yolk, which most people over 60 have been avoiding for decades based on outdated cardiovascular guidance, beef liver, salmon, and cruciferous vegetables like broccoli and Brussels sprouts. You do not need a supplement. You need 2 eggs in the morning. That single change begins restoring the raw material your brain needs to produce the neurotransmitter that these medications have been suppressing. Every morning, 2 eggs, whole eggs, starting tomorrow. Step 4, prioritize deep sleep with deliberate consistency. This is not a lifestyle suggestion. This is neurochemistry. During deep sleep, specifically the slow wave stages your brain enters in the first half of the night, your brain activates a system called the glymphatic system. Think of it as the brain's overnight cleaning crew. It clears the metabolic waste that accumulates during waking hours, including compounds that interfere with neurotransmitter function. When you are taking anticholinergic medications that already suppress acetylcholine, disrupted sleep compounds the damage by preventing the overnight restoration that partially counteracts that suppression. What this means practically: go to bed at the same time every night, within a 30-minute window, 7 days a week. Not 5 days, 7. The research on sleep consistency in adults over 60 shows that irregular sleep timing reduces glymphatic clearance efficiency by up to 40% compared to consistent schedules. That is not a small number. That is the difference between a brain that is partially recovering overnight and one that is accumulating damage without interruption. Same time, every night. The consistency is the medicine. Step 5. Move your body within 30 minutes of waking. Every single morning. Not a gym session, not a structured workout, 10 minutes of walking, outside if possible, inside if necessary. What morning movement does for your brain after 60 is not general wellness. It is specific and measurable. A study published in the British Journal of Sports Medicine found that even low-intensity morning exercise increases cerebral blood flow and triggers the release of brain-derived neurotrophic factor, or BDNF, a protein that supports the survival and growth of neurons, including the cholinergic neurons that anticholinergic medications put under stress. BDNF is sometimes called the brain's fertilizer, and the single most reliable way to stimulate it, according to the research, costs nothing and takes 10 minutes every morning, before coffee, before your phone, before anything else. That is the cognitive protection protocol. 5 steps. 1 conversation with your doctor you are now prepared to have. 4 daily habits that begin protecting your brain's chemistry starting today. You came into this video not knowing that the medications in your cabinet, ordinary medications prescribed for ordinary reasons, could be the most significant factor affecting your memory right now. You are leaving with the science, the names, and a 5-step protocol you can begin today. That is not a small thing. That is the conversation your last appointment didn't have time for. What I want you to carry out of this video is 3 things. The list of 9 medications, write them down if you need to, or watch this again. The ACB scale. Look it up before your next appointment and calculate your total score. And the cognitive protection protocol. 5 steps, starting tonight with a consistent bedtime, starting tomorrow morning with 2 eggs and 10 minutes of walking. Your brain is not failing you. It has been working against a chemical burden it was never told it was carrying. Now you know. And knowing is where protection begins. There is someone in your life, a spouse, a sibling, a parent, a close friend, who is taking one of these medications right now and has never once connected it to the way their memory has been changing. This video can reach them before the morning it matters most. Please share it with them today, not for this channel. Because the information their doctor never had time to give them is sitting right here. If you haven't subscribed yet, please do that now. Every week, I bring honest, research-based information about what your body needs after 60. The information I wish every patient had before they ended up sitting across from me. Subscribe so you don't miss what comes next. Everything I've shared today is based on published research and clinical experience. It is not a substitute for your personal medical care. Before making any changes to your medications, diet, or daily routine, please speak with your own doctor first. They know your history. Bring this information into that conversation. That is exactly where good medicine begins.